My name is Alyssa Delgado. I am a staff member at Catalyst Miami. Today, we will be having an info session on helping those that are currently living with cancer or chronic conditions and their caregivers. In collaboration, we are also with Dr. Blanca Noriega, which I will definitely give her the chance to introduce herself. Dr. Noriega, if you would like to say hello.
Of course. Hello, everyone. My name is Blanca Noriega. I'm a postdoctoral associate at Sylvester Comprehensive Cancer Center at the University of Miami. I'm from Peru, and I got a medical degree and practiced for several years there. But here at Sylvester, my work focuses mostly on understanding the different factors related to the quality of life of Hispanic cancer survivors. So thank you so much for the invitation.
Absolutely. And I'm going to go ahead and take my time, take it slow so that interpreters have the capacity to be able to say everything. Okay. So just getting started, this info session was promoted with the inclusion of chronic conditions because many of the resources we will be providing still apply. However, we will be emphasizing cancer due to its impacts. And in celebration of Breast Cancer Awareness Month as well. So keeping that in mind, we are going to go ahead and move forward. Abraham, thank you. So this is the agenda for this evening. First, welcome and introductions, kind of what to expect. So we are coming from a community-based approach. This is very much an info session because we do have expertise in this, but at the same time, we welcome all of you to be able to share any of your experiences or anything else that you have learned in any of your journeys with this or in the systems that you have had to interact with because of a specific diagnosis. As part of a disclaimer, we do just want to let you all know that we will be talking about stages and journey of cancer, and we will be talking about different other medical lingo that we will try to explain as best as possible. And you are welcome to at any point log off, come back on. We will be monitoring the chat and the waiting room to make sure that you're able to come and go if you need to. This is also being recorded, so if you are registered or you need to hop off early, you can finish watching the recording afterwards. And welcome anyone who is also watching a recording now after this is over. We will also be talking about health and wealth coverage, some of the financial resources, and just different resources in general. There's so many different and specific ones, and we're going to try to cover as much as we can. We're also going to go over emergencies and long-term planning, as well as some mental health support, and leave some time at the end for any questions that you all may have. So just some of the objectives. The goal of this info session is to provide some clarity on some of the medical processes. I know hospital settings can be a little bit scary, a little overwhelming, and we want to make you at least feel a bit more comfortable in going through that and going through anything you have to, right? Also having just overall better knowledge of resource options, enhanced ability to ask better informed questions when you are going through your specific medical journey, as well as an enhanced ability to make more efficient problem solving and planning decisions, right? Because as we know, health impacts other parts of your life. So now we are going to officially begin with the stages of cancer, like this journey. So Dr. Noriega, I'm handing it over to you.
Okay, thank you, Lisa. So as you can see here, the cancer care journey is long and complex. It has multiple phases. We usually identify at least 6 different phases. It started with the cancer prevention and ends with the end of life care. In this figure, I wanted to show some examples of strategies associated to each phase. And I'm going to briefly talk about each of them in the next slides. And also going to provide some links to educational resources related to each of the phases that are available, of course, for patients and caregivers. So the next slide, please. So the first phase is cancer prevention, and you can actually reduce your risk of getting cancer by adopting healthy lifestyle behaviors. Only a small portion of cancers are inherited, but around 40% are linked to modifiable risk factors. And here in this slide, I added the 10 recommendations to reduce cancer risk, which include, for example, having a healthy weight, doing physical activity, among other recommendations that you can go through. And also I included some educational resources that can explain a little more about what is cancer prevention. Next slide, please. Next, we have the early detection phase, which is the screening phase. And here, I'm talking a little bit about the screening tests that are often used to find cancer before someone has any symptom. The goal is to find and treat cancer at a very early stage. And usually it's your primary care doctor that is going to suggest one of these screening tests following some national guidelines. And you can learn more about it in the links that I provided there under educational resources. These are, for example, divided by age, by gender. And also here I listed some of the screening programs available in Miami. For example, the breast and cervical cancer early detection program that it's led by the Florida Department of Health. The Game Changer vehicle at UM that is led by Sylvester, and also the Florida Mobile Mammography, which is also available at different points in the city. The next phase is the diagnosis, which is basically once you pass the screening phase and you have your results, or maybe when you are having some symptoms, your doctor, in this case, and a specialist called the oncologist, can suggest doing one or more tests to diagnose cancer. For example, here it could be a biopsy. So these procedures are usually conducted to confirm that you have cancer, to determine the extent of the disease, and also to give you an idea of what could be your options for treatment. The next slide, please. So then we have the treatment phase. Once the diagnosis is confirmed, you can choose to receive, of course, treatment. And there are many types of cancer treatment. It could be, for example, surgery, radiation, chemotherapy, bone marrow transplant. And these are often called active treatments. And the type of treatment that you will receive will depend on the type of cancer that you have and how advanced it is. Some people will have only one active after cancer treatment. Most people have a combination of treatments. The next phase is called survivorship, but in reality, cancer survivorship starts at the time that you have been diagnosed with cancer. It includes people who have finished the active treatment and have no signs of cancer, but also includes people that are receiving treatment for a long period of time to control the cancer or to reduce the risk of returning, and also includes people that are living with advanced stage cancer. For any cancer survivor, it is important to keep a cancer care plan. This is a document which has the records of your cancer and your treatment history, as well as any checkup or follow-up that you need in the future. This document is meant to be reviewed and discussed with your healthcare team, which means the oncologist and the primary care team. Next slide, please. The next phase is called the end of life care. And this is when your medical team suggests that you should stop treatment because the cancer can no longer be controlled. And this is the time when the patient should really focus on physical, emotional, and family concerns. Usually your medical team will suggest hospice care. And sometimes this is, people don't know the difference between hospice care and palliative care. The goal of both programs is to provide better quality of life and relief from symptoms or side effects for people who have a serious illness like cancer. Both have a multidisciplinary team that address the personal, emotional, mental, social needs of the patient. However, hospice care, to be eligible for hospice, a patient must have a life-limiting terminal illness that's put the life expectancy within 6 months or less. And the goal is to help you feel better when a cure is no longer possible. On the other hand, palliative care is an example of supportive care, which is another phase. And it is a medical specialty, actually, that the goal is to provide medical care for people living in a serious illness. And it's provided to everyone, no matter the diagnosis or the life expectancy. And as you can see, supportive care can be received at any time on the cancer care journey. And it includes, for example, the social support groups, palliative care, and rehabilitation. And I included some educational resources in there.
Thank you, Dr. Noriega. Okay, so I know that was a lot of information, but all these slides will be available to you. And again, this is foundational and basic knowledge to help you navigate the information and to help you understand the process. And similarly, this is for those that have other chronic conditions that are not cancer. It's still similar in terms of how many people and doctors and team members you have to go through. It's a lot. It's a lot to handle, and it's a lot to deal with. Many interdisciplinary teams, because there's so many factors to consider, right? The actual biological and medical team, there's definitely always a medical social worker around, all these other things, oncologists. So all of that, I know many people tend to have think of dollar signs, right? In this country, healthcare is not a right, it's a privilege, unfortunately. And so there are different options. And so I listed the basic ones that we have here in this country, right? So we have Medicaid, which tends to be for low income individuals and families. Medicare, SSDI or SSI, the disability income, or just regular Social Security income, like post-retirement. Obamacare, the marketplace insurance that is provided by the federal government, which open enrollment starts in November, and then November to December, right? Or a little bit into January. And after that, you can only enroll in this specific plan on special occasions. Then we have private insurance that you can enroll in. Employer insurance insurance that you get through your specific job. Sliding scale clinics. You have the Jackson card as an option here in Miami-Dade County. And then out of pocket, just paying for everything as the bills come. And so these different healthcare options have their umbrellas, right? And under them have many different things that you need to know, or at least, or rules to follow, rather. And so depending on your specific diagnosis or what you need to go through, this is also part of how you will go through that, right? Thank you, Ideal. Yeah, so open enrollment is November 1st through January 15th, yes. So with those healthcare options, I just wanted to say it's really important to know the limitations within those, because then that will allow you to make the appropriate decisions, or at least plan a little bit better in terms of how you're going to pay for certain treatments. That determines what type of treatments you're going to receive. So it is very important to know the limits within your specific plan. And if you ever have any questions related to health insurance or need some guidance on that, you can always, depending on exactly what you have, somebody on our team, a health coach at Catalyst Miami, can help you. You can also ask your primary doctor. You can ask the HR liaison at your job. And if you don't even know where to start, it's okay. Start with Catalyst and we'll help you figure out where you need to go. So moving along into financial resources now, this is the tough part, right? So let's say you have insurance, but it's just not enough. It's not helping cover the majority of your expenses. And so we here have some links that we provided. And again, this will be provided to you after this presentation's over. So when it's specifically the diagnosis of cancer, there are very specific resources for that. Just like any other diagnosis, there would be very specific resources for that as well. So the typical go-to resource is usually 211. I know that there are some ill feelings about it because it is an overwhelmingly often used resource, right? So there tends to be a lot of wait lists. Maybe you don't even get a call back. It's very frustrating to even try to get somebody on the phone. So that is understood. We provide it here because it is still an active resource. But we did provide other ones that once you click on them, it has a lot of information. We just didn't want to put everything on here because everyone is looking for something different. So we provided some other nonprofits. No, you can go stay on the slide. Thank you. So we also provided some nonprofits because at the end of the day, any website that you see with .org is going to be a nonprofit organization, meaning that their funding is received as tax exempt, and it is received through special grants, and it's not for profit. Basically, they're not benefiting from you getting a service. And so we provided some more resources there. Unfortunately, for caregivers, there aren't a lot of resources. It's kind of sad. Social Security programs, for example, don't directly pay caregivers. However, there are certain things that can be done, right? So, or rather that can be sought after. So, for example, there is, it's mostly for like low income families where if you can do it through, kind of let it be known you have Medicaid, let it be known that you need a caregiver. And it's like a whole process you have to go through, but you can get different stipends for this. And then there's other options. For example, let's say you can't directly pay the caregiver. Well, then you can kind of make it like a business, right? And that you're hiring this family member to be the caregiver. So there's loopholes that can be done. And again, if you need some guidance on this, you can reach out to somebody here at Catalyst Miami, as well as getting some more information in some of the links we provided. We also provided some food pantries, some links to find some food pantries if you ever need some food. Let's say you're awaiting your food stamp benefit disposition. Sorry. So you're able to, at least get some help with those expenses so that you can cover your other health expenses. There's also different programs through Medicaid as well that you will be eligible for. And then also on the bottom, some transportation services if you ever needed to a ride to certain treatments that you aren't able to drive yourself, you don't have a car, you don't have anyone else that can take you, transportation is provided. But again, it is a process. You have to sign up and you have to make sure to submit everything necessary for these particular programs. So just continuing on, just some other programs that might be helpful or beneficial. There are some pet assistance and wellness programs for those of you that are, going through a rigorous treatment and don't have the capacity or the resources to care for your pets. There are things you can look into to get your basic needs covered for your pet. So that's veterinary visits, pet food in general, somebody to come and walk your pet, for example. And I think that's very important because I know pets can be of emotional value and help during this time. And then some other resources that we wanted to provide are some health insurance laws. This is very, very important considering policy can change every single year. As with health insurance laws, right? So staying up to date with specific healthcare laws, especially if you're a very active person within because of your health, the nature of your health, this is important to know. And again, this isn't that you're supposed to know everything all the time, right? But it's more so to kind of have a go-to for reference and to be able to ask better questions. Okay, I know that the law changes every year. I don't know which laws, but I know it can. Let me look into it, right? So now you have a better idea of what you need to keep track of. Another resource for when you can't go back to work after treatment ends, right? There are a couple of options that we're going to review. This is applying for disability benefits. This is applying in the state of Florida, for example, there really is no short-term disability. Florida is one of the less progressive states, to put it nicely, when it comes to this. And so there aren't a lot of options, right? You can try to apply for unemployment. You can try to apply for disability, but sometimes it can be a very long process. It can be a frustrating process. You get denied often. You have to file an appeal. How do you file an appeal, right? They don't make it easy unless you literally have a very serious life-threatening diagnosis. That's when they kind of work a bit more quickly. And then, of course, just some information on the Family and Medical Leave Act, which Florida does have to follow, right? And so just some information on that to, again, as a resource, some reference, you can look into it. And if you have any questions after reading through some of the material, you can reach out to a professional like us here at Catalyst or any other nonprofit representative that advocates for healthcare justice to better explain this to you.
So as any disease, there are some research opportunities out there. Probably from the pandemic, you have heard the term clinical trial. And these are usually studies that involve people. They play an important role because they are advancing science and helping future patients. The idea is that the trials are meant to test new ways to either prevent cancer, diagnose it, treat cancer, or manage the symptoms or side effects associated with the treatment, cancer treatments. So I put some educational resources so you can learn a little bit more about clinical trials in general, what to expect as a participant in a clinical trial, what kind of information you can get from a clinical trial. And also, if you're interested in participating in one and you would like to find if there's anything available for you, there are also some links here where you can get information about these clinical trials. Obviously, you have to discuss this with your medical team, make sure that it's a good fit for you, and they will give you the green light to go for it. All the clinical trials are registered in the first website, the one that says clinicaltrials.gov. Either if it's a pharmacological trial or, for example, if they are testing an application, a program to improve mood or, I don't know, symptoms related to the disease, any kind of clinical trial should be registered in that website. One of the benefits of participating in a clinical trial is, like, most of the time they offer compensation for those who participate. It's not much, but most of the time there is compensation for every assessment that you complete. So, yeah.
So moving on with long-term planning. So this is important for any person, even without a chronic condition, right? To think of the future and to make sure that what you're doing now in the present is helping establish, some sort of plan, right? Just to be ready, because you never know what could happen. And this is, again, without a chronic condition or not. When it comes to having a chronic condition, there are different steps that we can take in order to make you feel better about your plans, and to empower you and to just have you feel in control, because it can feel very out of control already, having to go through all of the medical procedures and limiting a lot of your things that you have to do in life. So in this, know that you have power and control here. And so one of the things that we offer at Catalyst Miami is financial coaching. It is also offered at branches through United Way, and this is absolutely free. There are other places that offer financial advising and coaching, maybe through your bank. They might offer it, but to a certain extent, like, I'm not sure if it would be free, right? Here at Catalyst, it is free. So we offer financial coaching in terms of budgeting, savings, preparing for retirement, connecting you with the systems that help you prepare for retirement. So for example, knowing that you have to reach a certain amount of work credit hours just to be eligible to receive Social Security eventually in your life. So all these little things, these little details are really important, because you don't want to get to a certain age and then all of a sudden they're like, no, you have to work for 10 years. And then you're like, what? And not know. And I know that happens a lot with a lot of immigrants and just, people that aren't as fortunate or as privileged to have access to knowledge, some of this knowledge. So here, that's what we're trying to do, just provide that education and provide you with that ability to be able to ask better questions and make better decisions and just overall plan. So with that, financial coaching is extremely important. One of the things that we can help you do is review your credit report and see any types of debt that you have. And some of the most common types of debt is medical debt. And a lot of the times I've seen on, clients' credit reports, this medical debt, and they say, I have no idea where that's from. I have insurance. That's not even supposed to be there. And remember that health insurance companies are all operated by people, humans, right? There is human error. So it is very possible that you were charged for something you weren't supposed to pay. You had no knowledge of it. All of a sudden, time passes. It was never paid, right? Because you didn't know about it. And all of a sudden, now it's on your credit report in a collections account. So now it's impacting your credit score negatively. And it's like a debt that you're not even supposed to owe. So we can help you contact this collection agency, help you contact the medical provider that billed this. And then if you're able to show evidence, hey, I wasn't insured at the time, we can have it removed and you don't have to pay anything. So that's just an example of what can be done to help you in like your overall long-term planning. So that debts like that aren't passed on to your next of kin or anyone else that might have to pick up things due to not having a plan. So aside from that, there's also planning for emergencies, things that are unforeseen. For example, this pandemic, right? Nobody foresaw this pandemic. A lot of things had to change and adjust. But when it comes to emergencies like hurricanes, right? We live in Florida. Just having a plan for example, if you needed to evacuate. So this is important because the EEAP is the Emergency and Evacuation Assistance Program. So this provides like free evacuation assistance to those living in Miami-Dade County who need specialized transportation and or like sheltering, who would like to receive a wellness call after a disaster, right? But you need to be registered for this program prior to the emergency, right? So it's if you require medical monitoring, assistance with daily living, or having life-saving medical equipment, because so you depend on electricity, you should register for this so that in the event of a power outage, due to a storm, you are protected, you are safe, and nothing is interrupted in your medical process. So really important. If you need help with registering for this program, we can also help you with that. And then finally, some estate planning. So this has to do with your plans for when and if you pass. So these are just some very basic things to remember and consider. So inventory your assets and estimating their values. Because at the end of the day, when we pass, anything that is within our name, within our home, is going to basically be reviewed and analyzed, and it gets dealt with basically. And if you don't have a plan or any type of will or something that you leave behind, the government kind of just like sends it out all out depending on the situation and circumstances. So really important to just kind of have documented your specific assets and estimate their values. Potentially having some life insurance. This is really important, right? Because this will also ensure that your cost or expenses are covered and not passed on to anyone else. So for example, this also applies to student loan debt, right? So if you have a lot of student loan that could potentially be passed on, or any other types of debt to your spouse, to your next of kin, your children, life insurance will cover all of that so that nobody has to pay any of your debts or potential debts. Something else is considering a revocable living trust. So again, these are some like words that require some more like a deeper understanding and explanation, but this again is just like a legal process. It helps bypass probate court and makes things a little bit more smoother when you do pass. Again, it's just more long-term planning. And by setting this up, you're kind of just documenting what you want done with your things, essentially. So with that comes establishing directives. So that means your medical, what you want to happen to you if something were to happen, in terms of your medical journey, what you want to happen, maybe it's a do not resuscitate, right? You can also establish a power of attorney, somebody else that you want to represent you on legal affairs, or on handling your assets, for example. So also reviewing beneficiaries. Who would you like to handle other things? Who would you like to have power passed on to, or would just like to handle your affairs in general? Very important to have. And this also includes, like, if you're awarded any type of compensation, money later on, this is who would receive it if you are not there to receive it. And then finally, just like the last thing, plan to reassess. You don't know what could happen, right? Everything could go fine and you could be okay and you could, get past this chronic condition, or, the laws may change and you have to reassess certain things in your estate planning. So this is all things to consider. And again, this is a very basic, like, amount of information. In the, like, there's so much to long-term planning, right? We're just like dipping our toes a little bit. But again, the more you know, the more you can better make decisions and feel in control of your life. Next slide, Abraham, please. Okay, so this next part for resources has to do with mental health. And again, anything that we do in life, like, our health is wealth, right? Going through something like having a chronic condition takes a toll. It takes a toll, creates a lot of anxiety, could potentially bring down your self-esteem. It could just disrupt the idea of what you thought your life would be like. And that is traumatic. That is traumatic. And so even seeing somebody else you love and care about go, like, have a hard time and go through something, a medical procedure, it's very impactful. So we need to be able to say that we're not okay, and be able to get the help we need. So we have some resources here. The Miami Cancer Institute is through Baptist Hospital. They have different support groups. They have like different therapists you can see. The same with Miami Health, right? It's understood that when you are going through a long medical journey, it takes a toll, right? Psychologically as well. So we have Gilda's Club of South Florida as well. Leukemia and Lymphoma Society. And again, these are more targeted towards those living with cancer. But again, they have different support groups as well, in terms of, whether it's for caregivers, for children. They have different groups related to just like anxiety, like people living with different things. It doesn't have to be just cancer specifically, but we have them here because they have them for cancer. So if that's what you're looking for, they are available, but they also have other different types of programming as well. And then, of course, I would also just consider the EAP programs if you have it through your employer that can provide a couple of free sessions of therapy. That is also possible. And then if you have Medicaid, there are certain providers that accept Medicaid. It's just about finding them, right? So think people or therapists that are in network. And then also being able to see, if you do find somebody that you like out of network, what's that going to cost? Is it worth it? If so, we can work on you with budgeting, right? Maybe you have to pay a little bit more, but this is the person that you really connect with. We will figure it out, right? We will try to make it happen. Okay, So then these are just some specific resources that we were able to locate. And again, this is all public information. This info session was to hold a space to be able to think about this and just read through some of this stuff. And again, just have at least a starting point for what you are trying to look for. So some of these, again, though, in the slide where it's italicized, like kind of slanted, you're able to see what they're for. So the help for young caregivers, you know, all types of support, medical equipment and supplies. Like there's, again, resources can be so specific, which is why, you know, we provide like so many or maybe more general ones, because again, we don't know exactly what you're looking for. So this is just, again, dipping our toes in, again, and giving you an idea that they do exist. It's just about doing your research, or at least knowing what to ask or what to look for. You can go to the next one. Again, just some different ones. I thought this one was really interesting. The Flying for Hope. It helps families in crisis by assisting to purchase flights, bus, or train tickets, right? So this is for if you have family members that are in another state and they can't get to you, they're struggling as well. I mean, it's a hard time for many, you know? So I think this was just important, you know, there are stuff out there, even if you don't know, but at the end of the day, we don't know what we don't know, right? Okay, and then you can go to the final slide, which is just questions.